We're going to begin the cardiovascular system by reviewing some very basic normal anatomy of the heart. This is information that I presume that you already know, but if you don't, be sure that you brush up on these basic structures. So we have drawn here a heart. We have it shaded in two colors. The blue side is what we refer to as the right side of the heart, and the red shaded side is referred to as the left side of the heart. The chamber which we have labeled RA represents the right atria. So this is going to be receiving blood from the body. It will then lead to the right ventricle. The right ventricle contracts and ejects its blood out the pulmonary artery and will take blood to the lungs. In the lungs, blood will be oxygenated. It will return to the left atria. The left atria leads to the left ventricle, and when the left ventricle contracts, it will be ejecting blood out through the aorta to what we refer to as the systemic circulation. Now, as the heart pumps its blood, it's going to be pumping the blood out into arteries in general. Those arteries will then eventually lead to arterioles. The arterioles in turn lead to capillaries. The blood will then flow through the capillaries and be collected in veins, and the veins then will return the blood to the heart. As we mentioned previously, we consider the heart to basically consist of two separate pumps. The left side of the heart we refer to as the systemic circulation, and it will be pumping blood out to the body in general. The right side of the heart we refer to as providing pressure to drive blood through the pulmonary system, which would be to the lungs. Inserted is a picture demonstrating the average pressure as we flow along the circulatory system. Notice that with the systemic circulation, these pressures are much higher compared to the pulmonary circulation. And now we will get into more details about these vessels as we move, but I just wanted to insert this graphic here simply to demonstrate that there is a great deal of difference in pressure that the left side of the heart has to create compared to the right side of the heart. That's also reflected if we were to do a cross-section through the ventricular muscle of the heart. Notice that the left ventricle is very thick-walled compared to the thinner-walled right ventricle. So the left ventricle is having to generate a great deal of force compared to the right side, hence the thicker wall. The other thing just to make note of with this picture, notice that the left heart is pumping out oxygenated blood, whereas the right heart is pumping out deoxygenated blood. Let's go through quickly the different vessels which will be carrying blood throughout our cardiovascular system. We'll start with the arteries. The arteries will always carry blood away from the heart. The arteries act as what we call pressure reservoirs. And what this functions to do is it helps us maintain blood flow throughout our cardiovascular system even when the ventricular muscle is relaxing, or what we say is in diastole. This graphic represents the heart. It's receiving blood from veins, and in this particular configuration it says the heart is contracting and it's ejecting blood out to the arteries. Notice what this is representing is it's representing that as these arteries are receiving the blood, the arterial walls are actually stretching. Now, realize that when the heart then relaxes, it's no longer able to drive blood forward. So there's a few things that are going to come into play that help us move blood forward. When the heart is relaxing, we don't want blood flowing back into the heart. And so this little valve here, and we'll talk about valves briefly, this valve will close and it will prevent the backflow of blood into the ventricle. The second thing that's going to happen is these artery walls, which are stretched out, they are going to recoil back. And as they recoil back, they're going to be driving the blood forward throughout our cardiovascular system. So this is why we refer to arteries as pressure reservoirs. The next set of vessels are arterioles. And I've included this graphic here, which demonstrates that a great deal of what makes up arterioles is the smooth muscle that's surrounding the arterial walls. Arterioles regulate blood flow to different tissue beds. So the arteries are just taking the blood out in general to the body, yet it's the arterioles which is going to specifically deliver the blood to different parts of our body. We refer to arterioles as resistance vessels. So the amount of resistance that these arterioles provide is going to be controlled by the degree of contraction of the vascular smooth muscle which is in their arterial walls. The relative distribution of blood to the various tissues throughout our body will be regulated by changing the resistance to blood flow through these various arterioles. So let's take a brief time to discuss resistance. Fluid flowing through a tube depends on the resistance to flow. Resistance is going to be related to the viscosity of the fluid, the length of the tube, as well as the radius of the tube. Now there is a formula which helps us calculate the resistance, and this is called Poiseuille's law. And what this tells us is that the resistance can be calculated by using these various variables. Now, as we've done in the past, we're not going to be using these formulas to calculate. We want to use these formulas to understand concepts. So let's see how we can simplify this formula to meet our needs. First, let's get rid of what are constants. The 8 and pi are both constants. In our body, the blood vessels essentially remain the same length at all times, so we can get rid of the L. And in a healthy condition, the viscosity of our blood also remains fairly standard as well. So this then boils this law down to simply the resistance equals 1 over the radius of the vessel to the 4th power. So blood flow is going to be directly related to the radius of the arteriole. As we increase the radius of the arteriole, we will be decreasing the resistance to flow. So the greater the radius of a vessel, the less the resistance, and the greater the blood flow through that vessel. After the arterioles, we have capillaries. Capillaries are the smallest vessel within our body, and they consist of just a single cell type, and we call those endothelial cells. So capillaries do not have elastic tissue, they do not have smooth muscle, they simply have the single layer of endothelium. This is where we're going to have exchange of materials. So they're designed to allow this to occur very easily. They're very thin-walled, they have a great amount of surface area, and they also have a high cross-sectional area, which is going to result in the slowing of blood as it passes through these capillaries. After we've had an exchange of materials at the capillaries are then going to lead to the veins. Veins are going to be returning the blood to the heart. Now, veins have some smooth muscle as well within them, but their great characteristic is they have the ability to be very compliant. Their walls can stretch, and as they stretch, they're able to accommodate volume of blood without having a significant increase in pressure. So whereas arterioles were vessels that we primarily thought about with regards to resistance, veins are vessels that we primarily consider compliance. So the greater the compliance of a vein, the greater the capacity they have to hold on to blood. So we refer to veins as volume reservoirs. We can adjust the compliance of veins by altering the degree of contraction of the vascular smooth muscle which is in the venous walls. As compliance decreases for a given volume of blood, the pressure within those veins will increase. And as that pressure increases, it forces blood to return to the heart. And we call that blood that returns to the heart venous return. So in summary, here is our cardiovascular system. We have our heart, which is our pump. It's going to be pumping blood out to the arteries. The arteries function as pressure reservoirs. The arteries then will lead to the arterioles, and the arterioles then will be responsible to distribute blood to different parts of our body based on need. And they distribute the blood by changing resistance. So the arterioles are our resistance vessels. They will lead to the capillaries, where we have our exchange of material. The capillaries then lead to the veins, which are our volume reservoirs, and then that blood in the veins will be returned to the heart, and we call that the venous return.